Okay. Yeah. So he presented with me with this 3 vessel disease because he had heart attack in September. Yeah. September, right?
Yep.
In Singapore hospital. So he was having a chest pain, then with breathlessness, and he developed this congestive cardiac failure. Yeah. So then he discharged himself from hospital after after they did this angiogram with stent, right?
Yeah.
So then he after that he do some changes in his life. Yeah. So he was quite obese before this. Then subsequently he changed his diet. Then he losing his weight, but at the same time he do some changes in diet and his lifestyle. Yeah. But he at the same time he want to look for some solution that actually integrate to his this treatment so that he actually can wean off his medications. This is one of the objectives. At the same time, he want to regain his health back. Yeah. And because at the time also he developed the side effect because some of the medications, right? So example like he has dizziness after he's taking the medication. We didn't he didn't know about this. Okay. So he came to me. Then the first time I assessed him, I say that actually he's on 12 types of medications. Okay. So this about I think about 4 to 5 months down the road after he discharged from hospital. After he's discharged from hospital, right? Yes, the medication try to control the disease. Yes. So, but the same time the body is recovered partly because he do some changes in life. Yes. But the dose of medication is still the same. Yes. So that actually giving a lot of problem for him. Because the example that 2 medication I identified that actually because I think the body can regulate his own blood pressure already. But we still give a blood pressure medication to suppress it. So that can cause the dizziness to him, in which that we as a medical doctor, we didn't realize that actually we do harm to the patients. Because patient has, at the time that they evolve along the way, after they do the changes to regain their health, so the body get better, but the medication is still the same from the beginning until in the process of the patients get healed, then it's still giving the same dose that actually that situation give side effect to the patients.
Yeah.
Yes. It's developed side effect impact. Yes. As doctors actually who also can give drugs. Yeah. Okay. So I see that it should be constantly to check on the patients and to look at the condition where if the patients get better, we have to balance up. If the patient get better, we should not give the same dose of medication to them, and we should think away, is there any other way to help them? Yeah. Using other methods that actually can regain their health further. At the same time, we can reduce the dose dependent on dose of medication. Yes.
Yep. My specific goal when I first came here was that I wanted to find another alternative approach to just fully relying on Western medication. But there were some symptoms along the way that I felt very giddy as I sat down, and it was just a simple exercise or simple movement of sitting down and getting up that I felt a bit giddiness. I didn't take it quite seriously. I thought I knew that it could be something to do with medication, but it wasn't worrisome or something like that. Yes. Yeah, but I know that in the long run, this cannot go on. So that was some kind of another motivation for me to want to make changes. Finding the root cause is another one. Finding the root cause of the problem. So really knowing what, and also of course getting some advice as well to really know how what are the changes. Getting assurances that I'm moving on the right step. Is that I'm actually doing the right thing, because if I were to seek treatment outside, I think generally most people will say just take the medication and things will improve. So I was thinking like, but there could be something else that I could do. I could change my lifestyle. Like I told you in during the interview, it's like I've improved my cholesterol on the first visit to the doctor by 50%, but it still seems not good enough to that doctor. So I was thinking that how much more do I need to do, and how am I going? I mean, my weight was also reducing. Weight loss was something that was a beneficial it's a consequence of making all these changes as well. I appreciated that, but that was not a motivation for me. But I think getting someone to believe in that same thing, that you don't really, that there's a choice other than just fully rely on medication, that's really the main motivation for me. Well, we have done our research before we met up with Dr. Lee and 𝗓𝗓𝗓𝗓.
Okay.
We wanted to find a doctor that is a practitioner himself, that they are certified medical doctors.
Yes.
At the same time, someone who believes in natural therapy.
Yes.
So, to be very frank with you, we searched the whole Singapore. We tried to find someone like that. It's always either one or the other. Never a merge or never someone who can do some integrated treatment. So that's why we have to make the commitment to come over here and to find someone who truly believes in that there's an alternative method rather than just purely on medication.
Okay, for heart disease, why we have to use the integrative way? Because we can't just rely on the medications alone. What can do is there's limitation on doing this. So when as patients on the drugs, the whole list of the drugs, we are trying to control the disease. But to recover from this heart problem, there is actually difficult because the limitation is there. So what the patient is, there should be combined the lifestyle changes and also the other the nutrition treatment, which actually those nutrients and herbs that actually help the heart to heal and the blood vessel to heal, and also to correct the underlying root causes is very important. For him, like him, he has toxicity. So we found the toxicity in him that actually can cause a lot of this damage. Oxidation of blood vessel, we should correct that. So, and we should find that also, the root causes. Instead of just leave it, then we don't know what happened, then they continue to take medications, which they also got limitation on this, which not correcting the root causes and not correcting all this holistic way of look at the more different perspective and different angle to correct the disease itself. Right? By doing that, that's where the problem can be solved. That's why holistic treatments is a multiple angle to look at things, so that we correct that. First, we find out first. Number two is we correct that, and then we solve the problem. So for him, the holistic, because holistic basically we use many angle way of to look at the patients as a whole. Instead of just conventional, what we do is like the difference is. Conventional, when we see the heart disease, we segment our brain is look at the heart. And then we treat the heart as much as we can, using drugs to control it. And then that's the way how it is. But holistic is actually, we look at the patients as a whole. So, and then where is the primary problem that actually lead to the heart disease? We have to find the root causes of it. Then the primary problem, the root causes, we correct that. At the same time, we're also correcting the underlying heart disease problem. So by doing that, this approach is much better outcome compared to just focusing, like if you have heart disease, we just focus on the heart, giving the drugs for the heart. And then you have diabetes, we focus on the drug for the giving the diabetes. For him, it's actually not, we're actually doing holistically. So what we find out actually, besides he has diabetes, we also find out actually he has hormonal problem, which I need to correct it. So he also has some nutrition deficiency in their different area, which I need to correct that. He also got liver, which actually I'm correcting that also. The gut also I need to correct that also. So at the same time, of course, we had to treat the diabetes as well as heart. So by doing that, then all these primary problem and then the root causes that we identify that lead to the heart disease and the diabetes is slowly get better. That's where the disease itself also get better along the way. And then that's actually where the healing start to take place. So that's the aim eventually is actually we try to treat the root causes and we try to heal the body. So instead of we give drugs to control and then we just wait for the complication to come, or we just prevent the complications. That's the approach is different from conventional, which that way to this way, which is a more holistic way.
Okay, how was the relationship? I think trust is very important. I think the first thing is you first find, for me, is that when we first found someone that can trust, that we have a different approach, a different mindset compared to conventional medication. There's some doctors practicing doctors that can actually believe that this is possible.
Yes.
Yeah.
So that's really quite a rarity. So we found someone we can trust that is not going to be telling us and guiding us to go back to the kind of same conventional methods that this is. So I think trust is the most important. With Dr. Lee, I think we trust him wholeheartedly because we believed that he understood our problem. He has found where we are. So the diagnosis has helped us to understand ourselves better. So I think my relationship builds basically started from that trust level, and then it slowly evolves around that. So without that, I think nothing could have progressed from it.
Dr. Lee, would you have anything?
What they say is trust is very important. So because of trust, so from there that actually we can find the problem together and then identify it. Then from there we give the solution accordingly. Of course, as doctor, the relationship is actually like what he is like a player. Like for example, he's a football player. So he's in the field. So he's actually facing the challenges. He's facing a problem, the health problem, and he also got some goals they need to achieve. So we had to work together with him. As me, medical doctor who actually work in the integrated approach, I work in this way is better like as a coach, because they had to be a player to regain their health, and at the same time they're facing the challenge which they had to overcome it. And also when we identify a problem, we had to tell them. So when they come in, when they do changes, this and that, when they're facing challenges, they come back and then we identify together, then notify, this is the problem you have, then you go back and then do it again and then make the changes here and there. Then from there, he do it correctly, then he get a good outcome, then we found out the solution for that, to solve the problem. So at the same time, of course, with my medical knowledge and integrated medical knowledge, actually we're coaching them so that they actually can do it properly in a safer way, so that they get the result they want. At the same time, they regain their health.
I think it could be from the very first meeting where we don't have so much knowledge and so much information. There might be conflicts with regards to diet, with regards to food, like whether you can eat a potato boiled or whether steamed potato, or simple things like that. I think it's more about conflict about the way food is being prepared. Like I said initially, I didn't know that there's good oil and bad oil. I thought all oil is bad. I didn't know there's good salt and bad salt. I thought all salt is bad. So my wife had that analogy as well. As long as it's salt, we shouldn't take so much of it. So we might even come to the stand that totally don't have it at all. But here I am, so I know that there's good oil that you can use, and there's fine salt that's good that you can use. So that kinds of improves our belief and education system a little bit, other than just totally eradicating it altogether.
Very good. Because every time he himself come in, we have a great discussion because we have questions to ask. Then then if I do this way, is it correct or not? If I eat this way, is it correct or not? If I go to that restaurant, I found this, is it this is correct or not? Then we also look at the data, and then from this monitoring of sugar, and then we look at it, and then we find it, and then we come to a conclusion that this is how it should be. Because a lot of learning actually, nobody will go and do studies on this actually, because a very customized way of helping the patients to solve the problem, because they're living the environment that actually that we need to, the doctor had to understand. Then to find all this information, how can you put all this together and look at where is that exactly the key point of problem and solve it. So that is actually had to work hand in hand very closely. Otherwise it's difficult. Just like we rely on just a possibility, and then that is not can get a good outcome like what we have now. So it's actually very close.
So you use your medical training and scientific data as references. But the real study is to study the patient as an individual.
Yes. Because he's different. He's come the environment from Singapore. So the environment look like this. So I have to understand the environment, what he's exposed to, the certain toxins or certain things that actually he has, and then the habits that he's influenced by others. So from there, I think we make a change from that. So slowly, one by one, we take out all this bad one, the good one, insert in and put it in. So he do it. Then he see the changes in himself. And then the wife was also very supportive. I would say that is as in what you say, the wife is quite knowledgeable. I think she every time she after that. Then she discussed with me further, and then we also work together helping him also. So the wife played a very important role also.
Yes. We could even encourage our friends or our colleagues to try and seek this approach of treatment if they want to do something about their health conditions. Because we know a lot of people with specific health conditions that just having recurrent problems on and off again and not seeking a solution. We know that they have help from Western medicine, conventional medicine. So we know that they have help from all these. But the problem keeps recurring and recurring and recurring. So it just puzzles me why people are not taking action to move forward. But I don't know. Maybe that's how they want to live for the rest of their lives.
Nobody would like to live.
I don't know, but then I can't find out compelling reason why they are doing it. Very happy with Heal Within. I think the process of the last maybe about 6 months now, the whole process since we came over. Firstly was it's not easy to find the research to find a clinic that does integration. I think that's firstly very rare. Certainly very rare in Singapore because we haven't found it in Singapore. That's why we came to PJ. Certainly rare globally as well. I think even in other countries as well. So it's quite rare for someone, a practitioner, to be doing something like that. So I think if someone else is committed for themselves or for their loved ones, family members, or even for their colleagues or friends, I think if they are committed to want to make changes to their health condition, I think this is the place to come to.